I rise today to sponsor a measure that seeks to end a silent cruelty that has for too long haunted the corridors of our hospitals. The unlawful detention of patients and even the withholding of the bodies of the dead because of unpaid hospital bills. This is a practice that cuts across our society. It victimizes the poor, the elderly, solo parents, and even those who simply fell sick at the wrong time. Sa ganitong practice, pinaparusahan nito ang mga may sakit dahil sila'y mahirap. At nilalabag nito, hindi lang ang ating saligang batas, kundi pati ang ating pagkatao bilang tao. No Filipino should ever have to beg to be released from a hospital bed. No grieving family should ever have to ransom the body of a loved one. Katuwang sina Senador Jinggoy Estrada at Erwin Tulfo, we propose to strengthen patient protection against hospital detention, to reaffirm what should have always been true, that healthcare is a right, not a privilege, and that compassion, not capacity to pay, must be the guidepost of our medical institutions. Mr. President, Republic Act No. 9439, the original law prohibiting hospital detention, was enacted almost 2 decades ago. Yet, despite its good intent, the practice persists. We still hear heartbreaking stories of mothers unable to bring home their newborns, of indigent patients detained for days, of families forced to surrender meager possessions just to claim their dead. This bill strengthens that law, giving it sharper teeth, broader reach, and stronger enforcement to ensure that no Filipino is ever again detained in sickness or in death for lack of capacity to pay hospital and medical bills. Una, pinalalawak ng panukalang ito ang saklaw ng proteksyon. Sakop na ngayon ang lahat ng ospital, klinika at katulad na pasilidad, pampubliko man o pribado. Walang institusyong makakalusot sa pananagutan. At hindi lang mga pasyente ang protektado, kundi pati ang kanilang mga kamag-anak, kinatawan, tagapag-alaga, at maging ang mga bagong silang na sanggol. Wala nang dapat gawing palit-ulo para sa buhay, kalusugan at dignidad ng tao. Ikalawa, pinangangalagaan nito ang karapatang makauwi agad. Kapag ang pasyente ay gumaling na, lubos man o bahagya, dapat siyang payagang umuwi kaagad matapos pumirma ng promissory note o katumbas na kasunduan. Walang dapat ikulong dahil sa kakulangan ng pera. At walang dokumentong medikal, discharge summary, reseta o medical certificate na dapat ipagkait dahil sa hindi nabayarang bill. Para sa mga mahihirap na senior citizen na inendorso ng Social Service Office, hindi na kailangang pumirma ni ng promissory note. Ikatlo, sinisiguro ng panukalang ito ang compassionate and humane treatment for the deceased. Inaatasan ng mga ospital na agad ibigay ang bangkay at mga kinakailangang dokumento, walang delay, walang singil, walang dagdag na pasakit sa pamilya. Para sa mga claims sa insurance o ari-arian, pwedeng gumamit ng kasunduang ligtas tulad ng deed of assignment. Pero kailanman, hindi dapat ipahiya o ipagdamot ang respeto sa mga naulila. Ikaapat, may mas mabigat na parusa sa mga lalabag. Ang sino mang opisyal o empleyado ng ospital na lalabag ay maaaring makulong ng hanggang 2 taon at 4 na buwan o multahan ng hanggang 300,000 pesos. Kung patakaran mismo ng ospital ang sanhi ang mga direktor o manager ay maaaring makulong ng 4 hanggang 6 na taon at pagmultahin ng hanggang 1 milyong piso. At kung paulit-ulit ang paglabag, maaari nang bawiin ng Department of Health ang lisensya ng ospital. 5, pinatitibay nito ang ugnayan ng health and social protection. Inaatasan ng DOH sa pakikipagtulungan sa DSWD, PhilHealth, SSS, GSIS at PCSO na tiyaking ang mga mahihirap at walang kakayahang magbayad ay ma-refer sa mga medical assistance program ng gobyerno. 6, nagbibigay ito ng mekanismo ng reklamo at hustisya. Gagawa ng grievance system sa DOH para sa mga pasyente o pamilyang ikinulong ng labag sa batas. Kailangang ipaskil ng mga ospital ang mga karapatan ng pasyente sa malinaw na lugar, sumunod sa standard discharge protocols at tiyaking na iaabot ang tulong ng gobyerno sa mga nangangailangan. Mr. President, this measure is more than a set of legal amendments. It is a declaration that our hospitals should never be prisons, that compassion must never be conditional. It also sends a clear message. While we respect the financial realities of medical institutions, no economic consideration can justify the deprivation of liberty or dignity of a patient. This bill strengthens the partnership between government and healthcare providers. It encourages a system of shared responsibility in which hospitals fulfill their duty to care and government agencies provide the safety nets that make that duty sustainable. Through this measure, we are not only strengthening the law, we are reaffirming our humanity. Mr. President, distinguished colleagues, I urge respectfully the swift passage of this measure. Let us make sure our hospitals remain places of healing, not of detention, places of care, not of profit, places of compassion, never of cruelty. Hindi po natin maikakailang habang humahaba ang buhay, posibleng dumarami rin ang ating mga karamdaman. High blood, diabetes, arthritis, dementia at iba pa. Many of our elders suffer quietly, often without access to proper care or support. Sa kasalukuyan, napakakaunti pa lang ng geriatricians, mga doktor na espesyalista sa pangangalaga ng nakatatanda. Wala ring sentro at espesyalistang ospital at programa na nakatuon sa kanila. That is why we need the Philippine Geriatric Center, a specialized hospital that will deliver affordable, quality, people-centered hospital care for senior citizens, promote integrated nationwide geriatric health services in partnership with DOH, LGUs, and other stakeholders, advance research on aging-related diseases, and translate findings into policy and specialized care. Provide consultancy and technical guidance to set standards in geriatric care across healthcare and residential facilities. Support the creation and maintenance of senior citizens' wards in government hospitals, and provide education and training in geriatric care for healthcare professionals, social workers, and community volunteers. Mr. President, this measure is not just about healthcare. It is about honoring our elders, ang ating lolo't lola who raised us, guided us, and kept our families close. It is about ensuring that they live longer, healthier lives with dignity and access to care. Through this bill, we aspire to celebrate old age with care. Para sa ating mga nakatatanda, ang Philippine Geriatric Center is more than a hospital. Ito ay haligi ng isang lipunang tunay na mapagkalinga. The DOH Hospital Bed Capacity and Service Capability Rationalization Act This bill addresses the long-standing challenges of our DOH hospitals and the regulatory bottlenecks that prevent them from meeting the needs of our people. The substitute bill, authored by this representation, together with Senators Pia Cayetano and Jinggoy Estrada, streamlines the approval process for increasing authorized bed capacities and hospital service capabilities. It also requires the DOH to regularly update and implement the Philippine Health Facility Development Plan, PHFDP, a living blueprint to guide modernization, optimize capital investments, and upgrade hospital facilities and equipment. The goal is simple and urgent: responsive, efficient, and quality hospital health care aligned with the actual needs of our population. Right now, DOH hospitals are under extreme strain. As of June 2025, mayroon lamang ang gobyerno na 60,395 hospital beds. At sa parehong taon, may naitalang 114,251 bed capacity gaps ang DOH based on its target of 2.7 beds per 1,000 population. The estimated bed increase for this year is 29,000. Increase for this year is 29,334. At inaasahang sa 2040, ang ating bed capacity gap, kapag hindi natugunan at naaksyonan, ay tataas mula 114,251 to 188,943 beds. And with a current occupancy rate of 136%, far above the recommended 80 to 85%, our government hospitals are naturally overcrowded, understaffed, and under-resourced. The consequences are clear: longer waiting times, delayed treatments, and limited emergency response capacity. As apex referral hospitals under the Universal Healthcare Act, these facilities are central to our healthcare provider networks. Yet, regulatory requirements, especially the need for legislation to increase capacity, delay critical expansions, sometimes for 21 months or even up to 3 years, leaving hospitals unable to meet the rising demand of our kababayan. Sa simpleng salita, ang kasalukuyang proseso ay mabagal at nakakasagabal sa pangangailangan ng ating mga ospital. Ang sakit, trauma, at emergency ay hindi naghihintay. Hindi pwede na ang batas ay laging nahuhuli sa pangangailangan para sa hospitalisasyon, para sa buhay at kalusugan. With the passage of this bill, we can fast-track modernization, align resources with actual demand, and strengthen compliance with universal health care. The PHFDP becomes a living guide, ensuring hospitals can respond efficiently to both everyday healthcare needs and emergencies. Mr. President, dear colleagues, this is not just about beds or equipment. It is about every Filipino, regardless of income, receiving timely, quality hospital care when it matters most. It is about a government that responds, adapts, and invests strategically in the health of its people. I appeal to my colleagues to support this measure, not just as a legislative priority, but as a moral imperative. Para sa mas maayos, mas mabilis, at mas accessible na hospital care at serbisyo sa bawat Pilipino. HOSIP, a national initiative to provide community-based care, assistive devices, and hygiene support for senior citizens and indigent persons with functional disabilities. Functional ability is key to healthy aging or active aging and healthy longevity. It means having the skills and opportunities to live a life you value, to meet needs, learn, move, connect, and contribute. Together with Senator Raffy Tulfo, we aim to identify and register seniors and indigent persons with sensory or mobility challenges, assess their needs through community profiling, and conduct regular visits every 2 months. The program will also provide free assistive devices such as wheelchairs, walkers, hearing aids, eyeglasses, and dentures, and distribute oral care and hygiene kits quarterly to eligible seniors and indigent persons. Through HOSIP, we reaffirm our commitment to care for those who once cared for us and still care for us, and to uplift the lives of the poor and the vulnerable. Let this measure be a step toward a more inclusive, compassionate, and health-equitable Philippines, where no senior or indigent person is left behind. Marami pong salamat, Mr. President.